Hi, welcome. I am Laurie Trungone, the service line leader for Women's and Children at Inspira Health Network. I'm glad that you're here today for our presentation. It is brought to you on behalf of the Spirit of Women program that we have here at Inspira. This program allows us to bring you timely topics so that we can provide information to you in a fun and innovative way. The purpose of today's program is to provide an overview of skin cancer prevention and sun safety recommendations. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you might have regarding a medical condition. With that said, we are using the On24 platform today. For those of you who have been with us in the past, you know that it has a lot of fun and interactive tools that you can play with. So feel free to click around and explore so that you can get the most out of your experience. All the windows on your screen are resizable and movable, so go ahead and move them around and get the most out of it. At the bottom of your screen, there are multiple engagement tools that you can use. Using the toolbar, you'll be able to download the slides and other resources, view the speaker bio, and even register for our next event, which is on May 25th, entitled Good to the Bone. That event will focus on orthopedics and will discuss, among other things, how osteoporosis can play a role in fragility fractures. In this virtual format, we cannot see or hear you. The only audio and video that is turned on is by our panelists. As usual, we encourage you to ask questions throughout the event using the Q&A button. Your questions will only be visible to our presenters, and your identity can remain anonymous if that's what you would like. This presentation is being recorded, and an on-demand version will be available after the conclusion of the event using that same audience link that you used to join us. To get us started, I am pleased to introduce our speaker today, Dr. Nandini Kulkarni. Dr. Kulkarni is a surgical oncologist and the medical director of Inspira's surgical oncology program and a member of the Inspira Medical Group. She completed her full medical school training, including residency and fellowship at premier academic institutions in India. Upon moving to the United States, she then completed a second residency and fellowship with a surgical residency at Abington Memorial Hospital, followed by a fellowship at Fox Chase Cancer Center, where she focused on complex general surgical oncology. She is double board certified in general surgery and general surgical oncology. Dr. Kulkarni specializes in breast cancer, as well as the management of melanoma and other skin cancers, liver and pancreatic resections, gastric and colorectal resections, and soft tissue sarcoma. She has over 12 years of surgical training and has performed more than 2,000 surgeries and has a genuine regard for improving the lives and experience of the patients suffering from cancer. Dr. Kulkarni, I think we've all gotten familiar with the dangers of prolonged skin exposure. Thank you and welcome for being with us today.
Thank you very much for having me, Laurie.
In fact, skin cancer is the #1 most common cancer in the United States, with 1 in 5 Americans developing some form of skin cancer by the age of 70. I know I, for one, love the sun, and there are some benefits to being in the sun. So we'll have Dr. Kulkarni explain to us what those benefits of the sun are.
Yes, so definitely, the benefits of a sunny day cannot be underestimated. You look at a sunny day and it feels so nice. Sunlight triggers the release of a brain hormone called serotonin that helps us to stay calm and focused. We have all experienced when there's low levels of sunlight, it results in a dip in the serotonin, resulting in what we call a seasonal affective disorder. And basically, you're sad. So, strong bones, sunlight in moderate amounts is necessary to boost our body's production of vitamin D. The daily requirement is not much. It's only 600, to 800 international units. So if you're outside for about 15 minutes, that is adequate for, getting your daily dose of vitamin D. There are a lot of other benefits. There's the possibility that it causes is it prevents cancer, skin healing. Believe it or not, UV radiation exposure is used to treat psoriasis, eczema, even jaundice in newborns, acne in certain situations. And, people are looking into research for other promising benefits like in rheumatoid arthritis, SLE, inflammatory bowel disease, and thyroiditis.
So you reviewed some of the benefits, but we all have heard that the risks of prolonged sun exposure can be significant. Let's ask our audience a question before you tell us what those are. Getting a tan in a tanning bed is safer than being in the sun. True or false? I don't see the poll question. Has it popped up? Well, we're going to just move to you telling us whether or not getting a tan in a tanning bed is okay.
Yeah, so it's definitely not okay. You know, there's ultraviolet tanning beds are not considered safe. Radiation from the tanning bed is just as harmful, or sometimes even more, because it's more focused and concentrated. But just to give you an idea about what we are exposed to from the sunlight, with this little diagram of ultraviolet radiation. And basically, there's your visible light has spectrum. You have the visible light in the middle, which is kind of the rainbow that we see. And then there's the infrared and the ultraviolet frequencies. So the ultraviolet radiation can actually be quite harmful. The wavelengths are classified as A, B, and C. And while they have, differing characteristics, all three of them can basically be harmful. And whether they're coming from sunlight or from a tanning bed, they do the same amount of harm.
I know that a lot of people think skin tone makes a difference, and that the lighter you are, the more at risk you are, or the darker you are, the less at risk you are. Can you help us understand whether or not that's true?
Yeah, great question. Definitely skin color and skin type is an important part of whether or not you would be at risk for damage. The lighter skin type, so, we kind of talk about the Eastern European, Irish, German skin type, very fair, light eyes, freckled. They tend to be highly sensitive to the UV light and tanning. They almost always burn. They hardly ever tan. And then as the skin type becomes more dark, there is a less sensitivity to the UV light, but it's not a resistance. That is the most important thing to remember. A lot of us darker skinned people, including myself, we tend to think that, we won't burn in the sun. That is not true. And the skin does get damaged over prolonged periods of exposure. So if you're not protecting yourself, you are just as susceptible to get skin cancer in the long run. But certainly the fairer skin types do get burnt easily and are more prone to skin cancers in their later years.
Yeah. In the United States, more than 9,500 people are diagnosed with skin cancer every day. I know in my own family, my grandmother, my mother, and my father have all had several instances of skin cancer. I also know there are different types. Can you explain to us what those are?
Yeah, certainly. So, it's interesting because the skin lesions range the full gamut from precancerous conditions to actual skin cancers. So the precancerous conditions, I've listed here like actinic keratosis and atypical moles. And then you have the actual skin cancers like basal and squamous cell and melanoma, and the very rare Merkel cell tumors. So actinic keratosis, and I won't go into a lot of details in the interest of time, but certainly these are the very common benign lesions that we see, especially as we start getting older. They're dry and crumbly. They kind of tend to develop in sun-exposed regions. And if left alone, some of them can develop into squamous cell cancers. So it is very important that a dermatologist, kind of keeps an eye on these lesions. Then you have atypical moles, or what is your dermatologist may call a dysplastic nevus. These are the unusual looking moles. They are still benign, as the number of moles increase, the higher the risk of melanoma. So, if you have more than 10 moles on your body, they say that you're at a 12% increase in risk of melanoma over the normal population. So there are certain syndromes like, atypical mole syndrome, where you may have more than 100 moles, and then you are at a much higher risk of melanoma in your lifetime. So these are just some things that a dermatologist will keep an eye on. So before I delve into the skin cancers per se, this is just a quick a cartoon of where the skin cancers arise. And you can see that, the squamous cells and the basal cell carcinomas tend to arise in the superficial layers of the skin, and they stay superficial for the most part. So unless you really let some of these cancers go for a very long time, they will not penetrate very deep into the skin. As opposed to the melanomas, which start in the superficial layers of the skin, but then they start penetrating through the skin into the underlying subcutaneous or fatty tissues, and they can actually access the blood vessels and the lymphatics and spread away from the original site in the skin. So this is kind of an example of what a basal cell cancer might look like. It's one of the most common skin cancers. It tends to arise from the superficial cells in the epidermis. They, like I said, generally do not spread to lymph nodes or other parts of the body, but certainly I have seen patients who have let this go for many, many years, and it ends up being a more burrowing type of cancer. But this is what it would look like, in the early stages. Then you have the squamous cell cancers, and a lot of us have experienced those. It's the second most common skin cancer, and it arises in the squamous cells, that compose pretty much most of the skin's epidermis. More than 1 million cases are diagnosed annually, and, people do die from it. Again, depending on the location, some of these can be high-risk lesions. And once again, they kind of present as rough, scaly patches. Sometimes they can bleed. They may even look like warts. You may think they're just a wart for many years before, things start kind of getting more advanced. So when we talk about treatments for these basal and squamous cell cancers, most of the time it is superficial and can be excised either surgically or with a special surgery called Mohs surgery. This is where the dermatologist specializes in this particular type of surgery, and they basically remove little bits of the skin at a time. You can also just freeze them with cryotherapy, and rarely it might need radiation. If you have multiple such lesions on your body, especially in the head and neck area, then your dermatologist might actually prescribe you an anti-cancer local cream that can be applied to, keep these cancers under control.
So we've all heard the term melanoma, and the American Cancer Society estimates that the statistics for melanoma in the United States are about 87,110 new melanomas diagnosed annually. About 52,000 are men and almost 40,000 are women. About 9,730 people are expected to die from melanoma. On average, a person's risk for melanoma doubles if they have had more than 5 sunburns. Just one blistering sunburn in childhood or adolescence more than doubles a person's chance of developing melanoma later in life. Can you tell us what melanoma means to us?
Yes, certainly. So, it's very common for me to hear the story of patients who, come in and all their life they have been out in the sun, and I'm sure a lot of us have stories of baby oil and sitting out on the beach with the tanning plates. So melanoma, unfortunately, is one of the fallouts of extensive sun exposure. It does account for less than 1% of all the skin cancers, but it tends to be the most fatal and aggressive. So it originates in the pigment-producing cells in the epidermis. They can look like moles for a long period of time, and a lot of them actually start in a regular mole. But over a period of time, basically the characteristic of the mole changes. Parts of it can become darker, as you can see in some of these pictures. And, that's when you kind of know that this is not quite a normal mole. Although most of the melanomas are either black or brown and pigmented, some of them can be skin colored or even pink or red or purple and look like a bruise. So, it's something that you have to be worried about if it's a lesion that's not resolving within a time period that you would have expected it to not. So when we talk about stages of melanoma, we kind of start off at stage 0 where the melanoma hasn't quite formed yet. This is just abnormal cells in the outer layer of the skin. It hasn't quite penetrated the skin, and so it's also called melanoma in situ and can be very easily treated by just a wide excision of the lesion. Once it becomes an actual cancer, that is, once it actually spreads into the layers of the skin, it can progress from stage 1, where it's still very local and, thin, to as the thickness increases, it becomes more stage 2. If it involves lymph nodes, it becomes stage 3. And then, of course, if it involves other organs in the body, then it is a stage 4 or advanced melanoma. So just to go over, some of the treatment options, a lot of us worry about melanoma being curable. I will say this today: if it is found early, melanoma is completely curable. Most of the time, just surgery is adequate, especially in the early stages. Surgery might involve removing just the lesion with a wide enough margin. Occasionally, if the lesion was deep to begin with, so if your melanoma was deep to begin with, we may want to check your lymph nodes with what we call a sentinel node biopsy. If the lymph node comes back positive for cancer, then there are additional treatment options in the form of immunotherapy, which is basically treatment that's given to you that basically boosts your own immune system to fight the cancer. There's also targeted treatments that basically look at certain mutations in the cancer and target them. And then more advanced forms of treatment like chemotherapy or limb perfusion, very rarely radiation. But a lot of backup treatments are now available, which were not available a few years ago. It has made the survival for melanoma much, much better in recent times.
So you mentioned early, catching something early. Is there a way for us to know if we have melanoma early and hopefully decrease our chances of having any major issues?
Yes, certainly. So, like I mentioned, a lot of melanomas actually start off in normal mole. You may have had this mole for years, even as a child, and then say in recent times, it starts changing. So what are the changes that you're looking for? And this acronym here, the ABCDE, kind of details exactly what we are looking for. So asymmetry is what A stands for, where you can see on the top is what a normal symmetrical mole would look like. And then on the bottom, you see that there's basically a change in the shape. So one half is not symmetrical to the other. Similarly, B stands for border, where if the border was nice and smooth, as in the top picture, that's fine. But when the border starts getting more irregular, that's when we worry. Color is basically if it's all one light brown color, or if it was dark to begin with, uniformly dark, and it didn't change, then that's normal. But when there's a change in the pigmentation where, parts of it start becoming darker, then that's when we kind of start worrying about it. And then the size of the mole, if it is smaller than a 1/4 inch, we kind of say the top of one of those pencil erasers. If it's smaller than that, then that's probably okay. But if it starts getting larger than that, then it's something that needs to be looked at. And then just as with anything in medicine, what is important is not one snapshot in time. It's how is it evolving? So a mole that's changing in front of your eyes is something that needs to be looked at. So those are kind of the warning signs.
And is there any other type of cancer?
Yeah, so, I talk about Merkel cell only because although it's very, very rare, and, I doubt, our general population would ever really come across this, we do know that it is far more aggressive and it actually ends up being fatal far more than even melanoma does. So although it's 40 times rarer than melanoma, it can basically result in a fatality in 1 out of 3 patients as compared to, say, 1 in 9 for melanoma. So these are also tumors that result from sun exposure. They can be treated just like melanoma with a wide excision. We do have to check the lymph nodes in all cases of Merkel cell melanoma, Merkel cell carcinoma. And sometimes, treatment with immune suppression can be offered. But because they are so aggressive, we really look for them. When a dermatologist is screening you, this would be one of the rarer cancers they would be screening you for.
Thank you for that. I think then it's important for us to know how to prevent any of these types of cancers, given what you've been teaching us so far. But before we start, let's ask our audience another poll question, or this time to ask a poll question. When it comes to sunscreen, the higher the SPF, the better. Is that true or false? So when it comes to sunscreen, the higher the SPF, the better. And we know that there's, SPF of 100 out there at this point, and as low as, I believe, 4. So let's see what people think. Give people a second to answer that, and then we'll have you tell us what that means. So it looks like most people think that that's true. 70% of our audience does, but 30% doesn't. So clearly that surprises some people that the higher the SPF, it is not necessarily better. So when you think about it, SPF 15 blocks 93% of the UVB rays that Dr. Kulkarni was telling us about, while there is a big jump then to SPF 30, which blocks about 97% of the sun's rays. But then when you get to 50 and 100, you get to 98 and 99. So it's a less significant of a jump. So Dr. Kulkarni, tell us, what should we be doing with respect to sunscreen and SPF?
Yeah, that's a great question, Laurie. That's a little bit of a trick question for the audience, because definitely between SPF 15 to 30, there is a very big jump in the extent of protection. I mean, definitely at any point, I would say some protection is better than no protection. But when I recommend to patients what they should be using, there's 2 things. I generally recommend at least an SPF of 30 or higher. And a broad spectrum sunscreen. So one that kind of tries to cover both UVA and UVB. So when you're looking at your sunscreen, definitely look at those 2 characteristics. The ideal recommendation is, you take the sunscreen about 30 minutes prior to going outside, and you apply an even layer to your entire body. And then after that, the most important thing, and the one that I think is the most boring for people to do, and that's where they skip, is reapplication. Reapplication every 2 hours. And when you go in the water, or if you're playing a sport that's getting you sweaty, once you're done, you dry off and reapply the sunscreen. When you come out of the water, dry off and reapply the sunscreen, because however much these companies advertise that it is waterproof, you really can't expect to be in the ocean and that sunscreen to still stick on you. So you have to reapply. I think that's where a lot of us, although we are really good about applying the sunscreen the first time round, once you're on the beach and enjoying the good weather, forget about the reapplication. Another thing that I want to kind of highlight here, Laurie, since you brought up prevention guidelines, is, yes, we all love the beach and we want to be out there, soak in the sun as much as possible. But there is a point in time where the UV index is the highest. And generally that's between 10 a.m. and 4 p.m. So I will say, enjoy the sun, but try to stay out of the actual glare of the sun between that time of 10 a.m. and 4 p.m. Try to stay under a shade, use sunglasses, try not to burn. That's just a horrendous picture there of a blistering sunburn. You really do not want to go in that direction. And then, of course, as we talked about earlier, avoid tanning beds. Any misconception that getting a tan before you go for a vacation so that you don't burn, that is a misconception. You really are getting damage to the skin even through the tanning bed. Covering up with clothing, again, it's kind of person dependent how much you want to cover up. If you've had a history of skin cancer, for sure, I would insist that, wear some form of light clothing that covers your, bare arms, your legs. Of course, when you're, until you're going into the water. Especially for children, make sure they have broad-brimmed hats and glasses. Good luck with keeping the glasses on, but, certainly try to keep them covered for as much as possible. And then routine skin exams. We kind of we take so much care of our general health and forget that an actual skin exam, head to toe screening, is just as important. So you can examine yourselves monthly. Basically, the mantra is to get naked in front of a mirror and look at yourself and examine for any moles that might be changing. You ask, your significant other or whoever can help you to look at the back, and then have a physician, screen you annually. There are some primary care physicians who are comfortable doing a dermatology screen. If you have the kind of skin type that's prone to develop moles and skin cancers, you probably should have a dermatologist look at you annually from head.
Through many of our Spirit of Women programs, we talk about prevention and screening so that we could either avoid issues or identify them early so that treatment options are more successful. So what should we do now?
So, as with everything, moderation is the key. I would never tell you to don't go out in the sun. That's just unreasonable and not practical and not fun. So moderation is key. It's a very nice slogan that the American Cancer Society basically started. It's called slip, slop, slap, and wrap. That basically kind of translates into slip on a shirt, slop on sunscreen, slap on a hat, and wrap on sunglasses. So, an easy little campaign there to promote skincare and basically skin protection.
Yeah, I like that. So we now have a couple of minutes for some questions. I know one of them you answered about how often sunscreen should be applied, and you had mentioned every 2 hours. A couple other questions. After a long day at the beach, my son's eyes get bloodshot and are quite red. Could his eyes be getting sunburned?
That could be a form of damage from the sun, and this is why we recommend wearing sunglasses when you're going to be out in the sun for a long period of time. So definitely take care of that, try to stay in the shade as much as possible. And when he's going to be out there, encourage him to wear sunglasses.
So the next question is, I have a suspicious mole that has been changing shape and darkening over time. Where is the best place to start? Should this person see their family doc or you? Where should they begin?
That's a great question. So, part of that is based on your comfort level. Your primary care physician's taking care of you for many, many years. That's a good place to start. A lot of family practice physicians will actually do the biopsy right then and there in the office. If you have a dermatologist that you follow with, or someone that's recommended to you, that's also a good place to start. And certainly in these kind of situations when patients request to see me, I would certainly do the biopsy in the office if necessary.
Are spray tans safe?
Spray tans have honestly not been studied enough, I think. I always worry about the additional chemical that's going on the skin and what the long-term effect of that would be. It certainly is not the same as a tanning bed, so you're not exposed to any sort of UV light. but we really don't know how that interacts with your skin in the long term and whether that would result in skin damage or cancer in the future. So, that's something that you have to kind of use judiciously.
Yeah, that's a good point, that there's probably lots of chemicals in there. One of the other questions, and it kind of relates to the chemical question with the spray tan, is it safe to just keep reapplying sunscreen all day long, knowing that there's probably chemicals in that as well?
Yeah, so, there are definitely some of the sunscreens, and you can look at their labels that are kind of more, how can I put it, less abrasive, I guess, to the skin, and it depends on your skin type. We know for certain that, the damage caused by skin cancer, so far there is no studied damage from the sunscreens that are being used. So it's kind of a little bit of, weighing your risks and benefits with regard to that. And again, like I mentioned, if you take some precautions regarding to the amount of time that you're exposed, then you automatically limit the amount of sunscreen you have to use.
Another question is it better to wear black or white in the sun?
So that's a great question. I don't think I've been ever asked that before. But if you think about the kind of, basically white reflects light. So in terms of you getting warm and heated up, wearing white is better. But, black looks cool any day. So I don't think the color of your clothing really has an impact on the damage done to the skin. But certainly in hot weather, I think wearing light colors is always cooler.
Right. When you're in the sun and wearing clothing to cover your skin, does the clothing offer any type of UV protection, or does the sun go right through the clothes?
So that's another really good question. So clothing does offer some protection to UV rays. You'll be surprised, but there are actually brands out there now that offer UV protection clothing. So, if you have a history of melanoma, you may want to actually invest in some of these clothes that have that kind of built-in UV protection. But just the physical barrier of the cloth is also to some degree protected.
Yeah, and I've seen some of those clothing. There's a woman who had skin cancer, and she has a great clothing line out there, and it is to offer UV protection, because she said, I don't want to not spend time in the sun, but I also can't afford any more melanoma. So thank you. And thank you very much, Dr. Kulkarni, for taking the time to help educate us today. Obviously, Dr. Kulkarni is available for appointments at the number on the screen. As you know, these types of programs have planning, coordination, and teamwork that gets done behind the scenes, and Sue's Plaskett-Bauer and Lauren Clinton always help us put these on for you. Dr. Kulkarni, do you have any closing remarks?
No, I just want to thank all of you for the opportunity to let me participate in these webinars. I think it's a great way to spread awareness in our public. We live very close to the shore, and, with the onset of summer, we all want to be outside. And I love to take this moment to just, be the mom and remind everyone to take care of themselves and their skin as they have a wonderful summer. So have a great summer.
Thank you very much. And I think it's obviously quite timely, given that it's, mid-May and everybody's getting ready for even just Memorial Day and being out in the sun. I do want to just make a comment that we have a person who made a comment saying, if you're ever unsure, please do get checked, that her husband waited and was diagnosed with stage 2 melanoma. He is now cancer-free, thankfully. But it was not easy, and obviously the course must have been difficult. If they hadn't caught it when they did, it could have been fatal. So she's recommending to please get checked, make sure that it's not spreading, buy hats, and be safe. So thank you all for joining us today. while we're still doing these virtual webinars, we do hope that we'll get to see everybody in person soon. Thank you to Dr. Kulkarni. And in the meantime, please remember to stay home when you can, wash your hands, wear your masks. I know those rules are changing as we speak. So are the social distancing rules. But if you're ever unsure or inside, I think the rules remain for inside. Please stay safe. Please stay sun safe as well. And thank you for participating with us today.
Thank you.